Well, to look at the latest on the pandemic and the politics of trying to contain it, I'm joined now from Ottawa by Kristie Kirkup. She's a national affairs writer with the Globe and Mail. And joining us from Winnipeg is Niigaan Sinclair. He is a professor and a columnist with the Winnipeg Free Press. Both of you, thanks for taking the time.
Great. Bonjour, hello.
Thanks for having us.
Let's start with, obviously this was a momentous moment. We saw the Prime Minister returning to the steps of Rideau Cottage with a strong message to Canadians. We saw the figures which came out today, the modeling or the data, the suggestions of what the rates are could be looking like. What do you make of it? Start with you, Kristie.
You know, I think that the image of the Prime Minister being outside of Rideau Cottage is perhaps taking us back to how we felt in the spring when we saw the Prime Minister emerging from his house every single day to do those news conferences. I even felt myself, kind of going back to that state in my mind of, okay, this is serious. And I think that was the message, intentionally so, from the Prime Minister, that, of course, with the modeling numbers that are out today, that the situation of course, differs in different parts of the country, but that it is increasingly dire. And he's really urging Canadians to stay home if they are able to stay home, to, again, limit their social interactions, their contacts. And he kept talking about tightening up and stressing that it's going to be a really challenging winter ahead, and that, people are going to have to take this seriously, especially ahead of Christmas. But I think what stood out to me, Martin, is he wasn't really proposing anything new. In fact, he made it very clear that he doesn't want to drop, as he describes it, a federal hammer, specifically referring to calls perhaps to look at federal legislation called the Emergencies Act or restricting travel between provinces. He's not looking to do that, he says, right now. And so he didn't announce anything specific in terms of getting things under control nationally. It was, again, the Prime Minister delivering that key message: stay home, just like I am right now outside of my house.
Yeah, another entreaty or another plea in a way. Niigaan, what do you take from what we saw today?
Yeah, well, I agree completely that it's a hark back to what the early stages of the pandemic looks like, and so it's intentional in that it's what it's meant to look like is what. And the Prime Minister used that language. Let's go back to the way in which things happened before. But he also made a real differentiation today in speaking about how during the early stages of the pandemic, it was often framed as an economy versus health issue. And what happened today is he's really trying to remind Canadians, explain to Canadians, articulate to Canadians that this is not an economy versus health issue. In fact, they are deeply intertwined as the two of them, so that if we are going to take care of the economy, one must get the sickness under control. And that's really, I think, what involves some of the minor announcements over the past 24 hours, that the employment benefits will continue. There'll be further expansions for businesses they've already got rent subsidies, but now will be getting support for keeping their employees on staff. So there's going to be a number of announcements coming forward. However, the Prime Minister has also made it clear to the provinces, because the provinces have acted so differently, some might call it haphazardly, particularly here in Manitoba, the Prime Minister, and the premiers have really come at odds, and we've seen that in recent weeks. Doug Ford, for example, calling the federal government in this talk of Emergency Measures Act, of referring to we don't want a nanny government. And so there's this kind of ongoing struggle, I think, between the premiers and the Prime Minister. And we saw a little bit of it today, the Prime Minister trying to give a macro announcement to get this thing under control.
Okay, I want to ask, while we have you there in Manitoba, because the last time we spoke, I remember you sort of stressing the fact that Manitoba had started out as one of the lowest rates of infection in the country and for much of the summer. But then what we see now is Manitoba per capita, in terms of hospitalizations, in terms of active cases, and in terms of deaths, way ahead of the rest of the country, if you want to put it that way. A very dire situation. Is there anything in Manitoba that you think the rest of Canada should be watching for, learning from, or avoiding?
Well, when you're describing a dire situation, you're not overemphasizing that in terms of on the ground here in Manitoba. We've just declared major lockdown restrictions to the point where yesterday the province announced that you are not allowed to have people outside of your home. You're allowed one friend You're also allowed only to have caregivers or people who are essential services involved with your interactions, everyday interactions. I mean, in Manitoba, Steinbach, which is one of the small towns, cities just south of Winnipeg, they're getting a 40% test positivity rate. That is absolutely insane. Because most places, like for instance, the hardest hit places in the United States are looking at 10 to 15%. Manitoba is somewhere in there, 12, 13, 14% test positivity rate. But in a small town of Manitoba, we're getting 40% test positivity rate. And what the real problem has been is that the Manitoba government opened up too soon, too aggressively, and did very much fall into that argument of we're trying to save the economy here, and if the health goes by the wayside, then we're going to let that go for a while, and they just let it go and go and go. The casinos were open, for example, till late last month. And the fact is that because the provincial government did not act in the ways that healthcare providers were asking them to act, now we have an exponential explosion, and we're leading, in many ways, North America in test positivity rate here in Manitoba.
I do the conversions to an equivalency of Ontario, and today, for example, or yesterday, Manitoba, if it had Ontario's population, would have registered 4,000 cases, active cases. Christy, I want to ask you, reflect on the countrywide, or the other aspect, obviously, is the reaction here in Ottawa. We saw, for example, the Conservatives coming out very strongly criticizing, very, very critical tone from the briefing that they were given in advance last night. Weigh in on either of those.
Yeah, so the opposition leaders were briefed on the modeling numbers that were released today, and specifically Aaron O'Toole has been very critical of the government, specifically on a few fronts, including suggesting that the federal government hasn't presented a plan yet in terms of a vaccine. And I think that this is increasingly, of course, going to be a huge part of the discussion as we see a couple of manufacturers coming out recently talking about how they believe that the vaccines that they've manufactured will indeed be effective. No vaccine has been approved in Canada, of course, by Health Canada, which will be a requirement in order for Canadians to begin receiving these vaccines. But the Conservatives specifically wanting, again, some specifics. I would say on that, though, that when you're talking about inoculating some 37 million people in the country, and you're dealing with an unprecedented situation like this, and also having to do things like keeping vaccines at a really cool temperature in order to ensure that the vaccines are indeed viable. These are enormous logistical challenges, which again are the subject of conversations that are playing out with officials right now. I think no one more than the federal government wants a vaccine to be rolled out of course, I think public health officials have made it clear that a vaccine is not going to be, as Dr. Tam would describe it, a silver bullet. It's not going to be that. The physical distancing, the hand washing, the mask wearing, these measures are going to be with us for some time. But again, opposition parties wanting things like at-home tests and demanding why those tests have not been rolled out. And of course, the government saying, we have to follow the science. It's science over politics.
I want to get briefly from you, 30 seconds each. Where do we go from here? Obviously, the Prime Minister and all political leaders and all public leaders are saying this really is up to us. This is up to the public. Any thoughts?
Well, this is a public messaging issue, particularly, and that's why we saw the Prime Minister come out today so aggressively, sort of ominously. Put it this way. If the cases continue and if we grow to 6,000 cases a day, as the projections show in December, we'll be looking at 5% of the entire country infected with COVID-19. That is daunting, that is scary, and if the public can't get that message, certainly there's got to be something that steps in from provincial or federal governments in order to make the public understand.
And Christy, as we head into the holiday season, some people have described it as a nightmare for public health authorities.
Yeah, it's interesting. I'll just mention the Prime Minister does keep referring to Christmas and saying, we're a few weeks out from Christmas, suggesting, of course, that, Christmases that we've had in the past, won't be on the table this year. But, I think that increasingly so, I'll just put it out there. My family talked months ago about not having a Christmas dinner. That is most certainly not on the table for us. And yet, somehow, politicians don't want to come out and be seen as the Grinch saying, they're saying, oh, we have a few more weeks and we'll see. And maybe if we can get these cases down, I think as Nigel laid to bear, these are incredibly serious numbers. And to suggest that somehow things are somehow going to change by the time that December 25th rolls around, again, I am a journalist just looking at the facts. And I think that public health officials are making it clear that that is going to increasingly less, not be possible. And so whether it's Halloween or Christmas or future holidays, until we have a vaccine, and when we're looking at specifically indoor gatherings, we're looking at, really following the public health advice to try and get this under control.
I think we all are thinking the same thing. I want to thank both of you for taking your time. Thanks for speaking with us.
Miigwech, thank you.
Thank you.